Manifest is one of the most exciting studies at this point in the myelofibrosis field. This is a large study. It has 3 arms, and 2 of the arms are combination arms. Arm 3 is the frontline combination of Pelabresib, the BET inhibitor, with Ruxolitinib in patients who have a JAK inhibitor naive disease, so they've never had a JAK inhibitor before. And this is probably the arm that has generated the most excitement because in this arm at 24 weeks, they saw a 68% reduction of spleen volume by 35% or more, and then a 56% rate of symptom reduction by 50% or more. Both numbers significantly higher than what you would typically expect from Ruxolitinib alone, thus testifying to the synergism of this combination, which has been shown in the lab and is just nice to be to see validated in patients. Also, at 24 weeks, they had about a 28% of bone marrow fibrosis improvement, which again is suggestive of the synergism, and occurred at this early time point, just 24 weeks, so 6 months, seeing a 28% improvement, by which I mean 28% of patients having a grade 1 or 2 improvement in their bone marrow fibrosis. So all the results, are very exciting, very impressive at this point. Like I said, the spleen and symptoms significantly higher than what you would expect with Rux alone, and this is again a proven synergistic combination. Also, the other arms of Manifest bear mention, particularly Arm 2. Arm 2 is where you add Pelabresib on to a patient having a suboptimal response to Ruxolitinib. Now, in this population, the results are more modest, but still interesting. Spleen was 20% and symptoms were 37%. Pelabresib also has an anemia benefit shown nicely in the JAK inhibitor naive arm with hemoglobins going up, and also in the add-on arm where you saw a 16% rate of transfusion independence. So as you look at all these things, it seems to be a combination that is doing a lot of things: spleen, symptoms, anemia, correlative studies like the bone marrow fibrosis that I mentioned, and also improvement in the driver mutation allele burden and in a whole array of cytokines that were seen across arms 2 and 3. So again, a very exciting combination for all these reasons. There's also arm 1, I won't get into that right now, but that's monotherapy Pelabresib alone, where too it had some activity for sure in terms of spleen symptoms and anemia.